Welcome to my presentation. So, to start off, I'm going to talk about the background information on what COVID-19 is and the signs and symptoms. So, according to the CDC, COVID-19 is caused by a new coronavirus. Coronaviruses are a large family of viruses that are common in people and many different species of animals, such as camels, cattle, cats, and bats. It's rare that you would see the spread from animal to people. The SARS-CoV-2 virus is a beta coronavirus that has a relation to their origins in bats. The virus started in Wuhan, Hubei province, and China, later spread to the US. CDC states that this pandemic of respiratory disease spreading from person to person caused by a novel coronavirus. The severity of this illness has reported to have a range from very mild to severe, which includes death. According to the CDC, although the illness is mild, an early report out of China has found that serious illnesses in 16% of people who were affected has led to death. The age group found that 80% of deaths were among adults 65 years and older, with the highest percentage of severe outcomes occurring in people 85 years and older. Some underlying medical conditions that play a great role in this are those with serious heart conditions, chronic lung disease, and diabetes. So for the signs and symptoms, according to the CDC, symptoms appear 2 to 14 days after exposure to the virus. Symptoms that appear are cough, shortness of breath, labored breathing, fever, chills, muscle pain, sore throat, and new loss of taste or smell. There are some symptoms that will occur if there's an emergency that needs to happen, and those symptoms are trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. At that point, you would call 911. Some people may not present with any possible symptoms, so practicing social distancing is key. What you should do, how it spreads, and what you should do for prevention. So how it spreads. According to the CDC, the virus spreads person to person. The virus is thought to spread between people who are in close contact with one another. Through respiratory droplets when someone coughs, droplets can land in the mouth or noses who have inhaled it nearby, can spread to those who are not showing any symptoms, and the virus is spreading more efficiently than the flu, but not as efficiently as measles, which is highly contagious. In order for you to prevent from getting sick, you must avoid being exposed to the virus, maintain good social distancing about 6 feet away, wash hands with soap and water, or use hand sanitizers that contain at least 60% alcohol. Wear a mask and routinely clean and disinfect touch surfaces. So the level of understanding from each individual about the precautions they should take in order to stop the spread. Well, I interviewed 6 individuals, and the ages are 27, 28, 50, 55, 60, and 89. Out of the 6 individuals, 5 of them could fully list the spread of the virus and prevention. The 89-year-old that I interviewed was unaware of any information in regards to COVID. Before I could even educate each individual, for the most part, each individual understood information on COVID because everyone except the 89-year-old work in the medical field or have family members who work in the medical field. For the 89-year-old, not knowing about information on the virus is very detrimental. The 89-year-old male lives at home alone but is receiving help from his grandchild. Because of the knowledge of what younger generations are well exposed to the media, have a better understanding on how to take care of their elderly parents. That is probably why the man is unaware of what is going on. So how are these individuals coping? Like I mentioned, most of the people who who I interviewed are those who are knowledgeable because they either work in the medical field or have family members that do. There are a lot of fears and worries that each individual would take home the virus to their loved ones. Some say they are having difficulty in sleeping and concentrating, but they love what they do. The stress and anxiety for most is at an all-time high when even stepping out of the house for necessities. The 89-year-old knew that he needed to stay indoors, but he says from time to time when his grandchild visits him, it makes him feel better. The 27 and 50-year-old are going through therapy to cope. Although the virus has caused distress to many of these individuals, they are still hopeful for humanity. People are more helpful in ways that they provide homemade face masks to healthcare workers. Even big companies like Tesla help manufacture ventilators for hospitals who have reached high capacity. Families are trying to make the best out of their situations with at-home activities. Appreciation for human life and connection, the utilization of Zoom for more than just online classes, drive-bys to celebrate birthdays and driveways, and celebrities donating their salaries to COVID initiatives. So the resources that I was able to use were from the CDC. So I gave these resources, the ones that talked about the stress and coping, stopping the spread of the rumors, prevention of getting sick, how it spreads, and how to prepare for it. What I learned from this experience is that social distancing is very important. It helps with preventing the spread from person to person. I feel that each individual who practices social distancing play a great role in helping our community from spreading this virus. The Stop the Rumors Fact information on the CDC website allowed me to understand in full detail information on what is true and what is not true. I feel that the media has taught us different information, and many times we gather our information from unreliable sources. It is always important to practice social distancing, proper hand hygiene, disinfecting areas that were used, and most important out of all is to keep away from people if you have any signs and symptoms of COVID. Once it starts to develop, going to the hospital is key in obtaining treatment. So what I will do when I follow up with these individuals is that I will make sure to assess their stress and anxiety levels and how they have been coping with the pandemic. I would also like to make sure to provide any updated information in regards to the COVID-19 and well educate myself beforehand. I'll be sure to follow up with them practicing social distancing and the morality in regards to their mental health, and making sure that they're not only maintaining their mental health but also their physical health as well. Thank you.